and turn here. Okay, it is your wish. First you can turn here, first the upper body, then you can go for lower body, or first turn lower body, or you can go for next for upper body. It's your wish. Okay, it all depends upon patient condition. So this is how you want to position, turn the patient. Okay. Apart from that, that's all. Next.
Preference of deep vein thrombosis.
This is very important. DVT. What are the reasons for DVT? Why? What is DVT means? Deep veins.
Deep veins.
Why the thrombosis is occurring here?
For leg.
Any bed rest complex, any bed rest, the first important thing is deep vein thrombosis. Whether it is an ortho case, whether it is an cardiac case, whether it is an neuro case, whatever the case it is. Okay, so what will happen here is generally when you are walking or when you are sitting, your calf muscles will pump the blood up, will pump the blood towards the heart. That's why we will call calf muscles as lateral hearts. They will call it as lateral hearts. They are also pumping like heart, how they pump from the legs. Okay, these calf muscles will pump the blood to the heart. Okay, so that's why they are called as lateral hearts. Now, because of paralysis, the muscles are not working. The muscles are not working. Then how the blood will go? No. So what will happen? Like drainage. Drainage, you know drainage? Wastewater. Like that blood will drain here only. Blood will stagnate here only. So after a long time, if water is there, what will happen? It will get dirty, mosquitoes, everything. The same way, here also, because blood is stagnated for long time, it will go for thrombosis, means clots. Blood will become clotted. Okay. So, generally patient will complain of pain and tenderness. Okay. So now, that's okay. Now, what is the problem here is, once deep vein thrombosis has occurred, now as a physiotherapist, doctor wrote that go and give physiotherapy. You people will go directly and you will give nice stretches, passive movement. What will happen? What will happen here? That clotted blood will break and they will go to the heart and they will come to the lungs. Patient will die. Patient will die. He will die within 2 to 3 hours. After once the clot reaches the heart, then to lung. What we will call this? Pulmonary embolism. What we will call this? Pulmonary embolism. Pulmonary embolism. Okay. So immediately after this, thrombosis reaches the blood, heart, and heart to the lungs. Patient will complain of chest tightness, breathlessness and all. Immediately you have to check, see whether there is any embolia or not. If you are not, definitely patient will die within 2 hours. So, as a physiotherapist, if anyone advise you to go and give treatment for a stroke person, don't go straightly directly and give something. Check everything, see whether there is any redness or if there is any swelling of calf muscles, or if patient is conscious, ask the patient whether there is any pain in the leg or do you find any swelling. Okay. Then, and also the ideal thing is do passive movements very gently. Don't give vigorous passive movements. What will happen? It will break the blood vessel and that clot will go to the heart, reaches to the lungs, patient will die. You understood? So because of physiotherapy, lot of stroke people are leading to a death. Okay, so don't go for that, please. Okay, and preventive things is applying stockings. You might have seen in hospitals and all, every patient bed rest people will apply stockings. That stockings will give an compression relaxation so that blood will pump regularly. Okay, or any other pneumatic devices. What is that? Pneumatic device. Pneumatic device will passively compress the and relax. Compress and relax. So that blood will drain clearly. There won't be any stagnation in the blood. Okay? So don't, from physiotherapy side, okay, don't ever give an passive stretches for patients who are in acute stage. Acute stage, no stretchings. No stretchings, no stretchings. And gentle passive movements. Very gentle passive movements. No vigorous passive movements. Okay? That may lead to death of a patient. Be careful. Okay? So this is to prevent deep vein thrombosis. And one more important thing is elevation. Elevation will automatically drain the blood to the heart. Okay? So these are very important things which you have to keep in your mind. As a physiotherapist, what you have to do here is, once if you go the patient, if he is unconscious, okay, check the cough, okay, see whether there is any swelling or not, even there will be heat, warmth will be there, check for warmth, check on both sides, let it be his left side is affected, check warmth on both sides, okay, if you feel any difference, more warm on that side, definitely just tell to the doctor that I am feeling some warmth over there and swelling. They will take care. Okay. Next is, if nothing wrong, then slowly give a gentle passive movements and advise nurse for keeping it in elevation and stopping. This is what from physiotherapy point you can do. Okay. And what is the complication of deep vein thrombosis? Pulmonary embolism. Okay. Do you feel anything? Person having complained, morning has done, you have attended a morning, one more physiotherapist has done, then you are attending in the evening session. Patient is telling that, sir, I am feeling some breathlessness and all, okay, and I am feeling some pain on the cough and all. Immediately what you have to do? You have to refer him to the doctor. Okay, so the earliest the patient can get the treatment, he will survive, otherwise he will. Okay, so these are very important. The pressure sore, first one is chest complications. We have seen how to prevent the chest complications. Okay, for unconscious patient and conscious patient, we have seen how to prevent the pressure sores, proper positioning, proper handling and all. Next one is what? We have seen how to prevent deep vein thrombosis. Okay.